Alright, let's dive into something that's both shocking and deeply concerning: medicine waste in England. Here's the kicker. According to the National Pharmacy Association, NPA, the amount of wasted medicine in just 1 year could fill 75 swimming pools. Yes, you heard that right. 75. Personally, I think this is one of those stats that stops you in your tracks. It's not just about the sheer volume, it's what it represents: a massive drain on resources, both financial and environmental. What makes this really interesting is the scale of the problem. We are talking 3,400 tons of partly used medicines tossed out in 2024 to 25. That's not just a few leftover pills here and there, it's a systemic issue. And it's costing the NHS at least £480 million annually. From my perspective, that's money that could be spent on improving healthcare services, hiring more staff, or investing in new treatments. Instead, it's literally being thrown away. But here's where it gets even more troubling: this isn't just a financial issue. Olivier Picard from the NPA points out that wasted medicines have environmental and health consequences. And he's right. When medicines are disposed of improperly, they can contaminate water supplies and harm ecosystems. What many people don't realize is that even unopened medicines, once they leave the pharmacy, can't be reused. It's a one-way trip to the bin. This raises a deeper question: why is this happening? One thing that immediately stands out is the issue of repeat prescriptions. Patients are often prescribed more medicine than they need, and without regular reviews, these medicines pile up. The NPA suggests that more frequent reviews could help identify medicines that are no longer needed. Personally, I think this is a no-brainer. If we can catch these issues early, we could save millions, and those 75 swimming pools worth of medicine. Another detail I find fascinating is the role of patient behavior. The NPA urges people not to over-order medicine. It sounds simple, but it's a habit that's hard to break. If you take a step back and think about it, we've all probably had that drawer full of half-used prescriptions at some point. But what this really suggests is that education and awareness are key. Patients need to feel empowered to question their prescriptions and only order what they truly need. Dr. Rasha Abdelsalam Elshenawy brings up another critical point: leftover antibiotics. She warns that keeping these at home can lead to misuse, which fuels antimicrobial resistance. This isn't just a minor issue, it's one of the biggest threats to modern medicine. What this really highlights is that medicine waste isn't just about money or the environment, it's about public health. Now, the NHS isn't sitting idle. They've introduced tools like the NHS app to help patients manage prescriptions better. But, in my opinion, there's still a long way to go. Local campaigns are great, but we need a more coordinated, nationwide effort. And let's not forget the broader context. This is happening at a time when the NHS is facing some of the most severe medicine shortages on record. It's like one step forward, 2 steps back. If you take a step back and think about it, this issue is a symptom of a larger problem in healthcare: inefficiency and lack of communication. Patients, doctors, and pharmacists all have a role to play, but the system itself needs to be more proactive. What this really suggests is that we need to rethink how medicines are prescribed, reviewed, and disposed of. So, what's the takeaway here? Personally, I think it's this: medicine waste isn't just a statistic, it's a call to action. It's about being more mindful as patients, more vigilant as healthcare providers, and more innovative as a system. If we can tackle this, we are not just saving money or protecting the environment, we are safeguarding the future of healthcare itself. What do you think? Is this an issue we can solve, or is it too deeply ingrained in the system? Let me know in the comments below. And if you found this video eye-opening, don't forget to like, share, and subscribe for more deep dives into topics that matter. Thanks for watching.